Salam Sejahtera, my name is WYG, metric number 780914035024-001. I am from Kota Baru, OUM Center. The purpose of this recording is meant for the presentation for question 2 of HDPS1203, Child Behaviour Management. The main objective of this assignment is to expose us, the learners, to the many different ways of handling children's behavior, which may include positive and negative behaviors. As we know, children, toddlers, they all exhibit all kinds of behavior. Positive ones include those which obey the school rules and teachers' instructions. Negative ones are the ones that against or choose to not to comply to school rules. Question 2 shows a figure that a toddler is biting another, and the question asks, why do some children choose to bite? What are the factors that contribute to children's biting? And the question requests us to also suggest appropriate actions or strategies that can help stop children from biting. The structure of question 2 requires us to have one introduction, body content that includes factors contributing to biting, and next, the steps or the ways of dealing with children who bite. And the video presentation must end with one conclusion. As for introduction, biting is commonly found among toddlers aged 6 months, 9 to 9 months, and even up to 12 months, and some up to 1.5 years old. They tend to bite either their sibling, brother or sister, or their classmates, their friends, at the nursery center. So why do children bite? Some children of older age, 3 to 4 years old, have the tendency to bite too. They bite their friends while attending school. What are the factors that contribute to children biting? First factor, teething. When children are having teething problem, that the tooth is still growing, in the process of growing, they find the pain and the teeth is aching. So the gum, they feel lots of discomfort in the gum and they want to vent out their frustration. They feel uncomfortable, they are emotionally not stable, yet they do not know how to express it. What do? They bite another toddler or they bite their sibling. Factor number 2. Children of older age, 3 or 4 years old, tend to bite their friends or bite their siblings when they cannot get the attention of their parents, the teachers or guardian. Because they yell and scream and talk to you and yet they do not get proper attention, they resort to biting. How unfortunate. They also bite because they want to get something that they cannot. They want to get something that they wish and they cannot get. So when they cannot secure something that they want, they resort to biting. The two factors clearly presented. What are the steps to deal with children who bite? First, for teething problem, for the first factor, how do we deal with it? We provide them with safe toys. There are many safe toys in the market provided by the toy maker. These safe toys are meant to solve the teething problem, the itchy gum and the discomfort in the teeth. And normally the safe toys are soft, spongy, and not harmful to the gum. While it may appear to be a little unhygienic when you see them biting the safe toys, but it's totally safe. safer than biting the siblings or the friends. So that's solution number 1. Step 2. As for children who bite because they want the attention, they desire for what they want and they desire for the attention they want to get from the parents, teachers, or guardians, what do? We sit down, spend time with them, talk to them, get them to understand. Yes, they can ask for attention, they can acquire attention through all kinds of methods, but not biting, because biting is unhealthy. So method number 2, talk to the children, make them understand, spend time with them, tell them biting is wrong. Method number 3, the third method to solve children who bite. Under positive guidance, we learned that one of the guidance strategies is to set boundaries or refine the context they are in. If they bite and it's wrong to bite, we must show them there is a limit to everything they do. If they are venting their frustration, expressing their emotion because they want something, we should tell them they can resort to all kinds of manner, but not biting. The limit is up to how they should show their anger. So the boundaries that we set and we explain to the children should be very clear, that biting is unacceptable. You can do all sorts of things, but not biting, because biting could be harmful to another party. Setting boundaries and making your point clear is very important for toddlers and also children aged 3 to 4. Method number 4, we should educate them that apart from biting, there are many other options that they can resort to solve the anger, to control their anger, the struggle that they have, that they vent onto the others, which is totally wrong. So we tell them, next time, when you do not know how to control yourself, you want attention, or you want something, please tell us very nicely and do not bite your sibling or brother or sister. Tell them very clearly what are the other options that they can use to control their anger. For example, instead of biting, you can tell mommy what you want. If mommy is not listening, you can say a few times and call me again and again, or even raise your voice because I'm naughty, I'm not listening to you. So I would give you the attention definitely. I'm sorry sometimes I don't listen to you, but from now on, promise me you don't bite, and we should talk, and you will get what you want. That's the 4. Those are the 4 methods that we could resort to. So in conclusion, in order to solve the 2 factors causing biting, we have 4 steps that we can go through as caregiver, and hopefully the children will be able to stop biting. So with this, the assignment helps me to understand how to deal with children who bite and how to stop the behavior. Thank you for listening.